Welcome everyone. Thank you for joining us today for our webinar on tools for implementing healthy food retail practices. My name is Vanessa Clarkson and I manage the Nourish Network, which is a multi-sector collective working to improve food retail environments. I'll shortly hand over to our guest speaker, but before I do, I'm going to run through a few housekeeping notes. So when everyone joins the webinar, your camera and microphone should already be turned off. But if you can keep your microphone on mute and your camera off for the duration of the webinar, unless you've been invited to ask a question or when we're in the interactive session later on. When you've been identified to speak, please unmute yourself and activate your camera if you want to. You can also put your questions in the chat box as we go along, or raise your hand and you'll be invited to speak during the question session later. Please make sure that you've assigned yourself an identifiable participant name. And on the right hand side there, you'll see the agenda for today. So we're just going through the housekeeping now and an acknowledgement of country. And then Tara will present for about 20 minutes. We've got then 10 minutes or so for some questions from the audience. And then we're going to have two interactive sessions that last about 10 minutes each, where we will separate out the participants into a number of breakout rooms, and we'll provide you with some instructions around what to discuss and how those will be run later on in the webinar. And then at the end, we'll come back together and we'll have a wrap up and go through the next steps as well. So we'd like to begin with an acknowledgement of country. So we acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to the land, waters and culture. We recognise that country has always been a place of sharing, teaching and learning, and we pay our respects to elders past, present and emerging, and extend our acknowledgement to any Aboriginal or Torres Strait Islanders with us today. So thank you for that. I'll now hand over to our guest speaker today, Dr Tara Boelsen-Robinson, who's going to share her work. Thank you, Tara.
Thanks, Vanessa. I'm going to start off with a few acknowledgements of my own. So firstly, the Australian Prevention Partnership Centre for funding this project and the support we've received from Dr Michelle Irving. I'd like to also acknowledge my contributors to this project: Anna Peters, Nicole Ward, Miranda Blake, Ajay Gupta, Julie Brimblecombe and Kathy Ma. And finally, I'd like to thank Vanessa Clarkson and Margaret Rosman for inviting me to talk today and for the idea to share my project with you, and for the Nourish Network. The Australian Prevention Partnership Centre I've put some details up from them here. So if you're interested in finding out a little bit more about what they do and what they fund, then you can visit their website. And I'd also like to quickly acknowledge the Healthy Eating Advisory Service, who provide some really fantastic services for Victorian organisations looking to implement healthy food retail practices. My talk today is going to have a more international focus, so I just wanted to kind of direct you to them if you're interested in some local support, and there's information on the slide there. So the aim of this session is kind of twofold. Firstly, I'm going to talk you through our project, what we did, what we find, and what we kind of think are missing from resources and tools currently. And that's going to be followed by an interactive session. And we're really keen for you guys to talk to each other about what you think's missing and what you want to see. And we're keen to hear your feedback on that. So As we're all very aware, healthy food retail is a kind of key leverage point for intervening and improving on population diets. And there have been a lot of resources and tools that have been developed in order to achieve this. However, we currently don't know the scope of the resources available and the nature of them. And so it's really important to understand what currently exists out there in order to avoid duplicating effort in creating more resources. So the broad overall aim of this project is to identify what resources and tools are currently available to help retailers shift to healthier food provision, and also to look at what seem to be the gaps in resource provision currently. And so the three key outcomes that we're keen to see is we really want to be able to link stakeholders to existing tools. We want this project to inform the development of future tools, and we're also going to turn this into a peer-reviewed publication. So I'm not going to talk you through in great detail in the methods, but briefly we searched NGO and government websites in high-income English-speaking countries, and we identified resources and tools that were aimed at supermarkets, grocery stores, restaurants, takeaways, universities, workplaces, and many others. However, we excluded schools, preschools, and aged care facilities, as these are kind of focused on communities that might have specific nutrition needs. We looked at identifying toolkits, guidelines, funding mechanisms, networks, awards schemes, and training components. We extracted a broad range of information, including on what kind of retail setting it was aimed at, who the targeted users were, and what aspect of the food environment the resource was aimed at addressing. We also looked at whether the resource considered issues such as socioeconomic position and low-income communities, whether it integrated aspects of environmental sustainability, and whether it included recommendations on stakeholder engagement and evaluation of interventions. So getting straight into the method, the results, sorry, we screened 2,500 websites, and from this we identified 75 resources and tools. And on your right, the right side of your screen, you'll see the breakdown of the kinds of resources and tools that we identified, and you'll see that the majority of them were guidelines and toolkits, and that's what I'm going to focus on in the second part of my presentation. So overall, the resources were aimed at a variety of different retail settings, including kind of cafeterias and cafes, vending, grocery, restaurants, and internal catering. And they also looked at different contexts, such as sport and recreation, government facilities, healthcare, workplaces, and local or small scale retailers. And many resources also looked at multiple settings and contexts within one guide. In terms of the content, almost a quarter of them mentioned environmental sustainability in some way. However, most of these were quite brief, and we didn't really see a lot of evidence of integration of environmental sustainability into recommendations. Quite a few considered business outcomes, such as thinking about the retailer perspective and profits as a result of interventions and policies. And 37% kind of mentioned the issue of dietary inequality or considered kind of low-income communities. I'm not going to talk you through all 75 resources because that would be a little bit boring. I'm going to talk you through 3 toolkits that I think each have really nice examples of different recommendations. And I'm going to focus on international examples here because you're probably quite familiar with the Australian specific resources. The first toolkit I'm going to talk you through is one that was developed by Canadian Health Services for vending machines. And I think this one is a really nice example of how to engage lots of different types of stakeholders at different processes of development and implementation. And it also has some examples of sample documents. And as I mentioned before, we're going to be sharing these slides with everyone here, and I've made links within this presentation to the PDF, so you can look at them in more detail. So this vending machine toolkit has 8 steps in order to develop and implement a healthy vending policy. And in each of these steps, a variety of different stakeholders are explicitly considered. So for example, in the first step, they make recommendations about building an action team. And what I think is really great about this resource is they not only identify the different types of stakeholders that are important to consider, but they really clearly articulate what their roles could be in implementation and policy design, and the different actions that they can take. This resource also has some nice examples of sample documents that can kind of be lifted out and used in practice quite quickly. So this sample letter is one that if you're a health promotion practitioner looking to implement healthy vending policy within your hospital or health service, you could take this to engaged senior management and kind of get them to sign this. And you could take this to your vending machine supplier or your procurement management manager to show support for this initiative. And although this is quite a simple example, I think that it's likely to add a lot of benefit for someone who is kind of starting from the ground and looking to implement this policy. The second toolkit I'm going to talk you through is one that was developed by a variety of UK organisations, including local government, environmental health and researchers, and it's aimed at takeaways in low-income communities. And so it's a really great example of how to integrate the consideration of low-income communities at different stage of design and implementation. And it also has some really great examples of how to think about things from a retailer perspective. So thinking about business profitability. So on your left, you'll see a figure, and this is just adapted from the resource itself. And I'm not going to go through it in detail, but it's just an example of the different considerations that takeaways in low-income communities need to consider. And there is really an integration of these kind of considerations throughout the entire resource in designing the interventions, in considering what engagement strategies will work best, and also in choosing the different kind of business models that are likely to suit retailers servicing low-income communities. And there's also a great example of specific healthy food provision changes that the takeaway can make, and this is categorized into product, price, promotion and place, which you might be familiar with as the 4 Ps of marketing. And not only do they provide really specific examples of how to produce cost neutral changes, but within the document are embedded links to video case studies. And these case studies are kind of, 2 to 3 minutes long, and they demonstrate successful implementation of these kind of healthy changes. And what I like about this is that they're often done from the perspective of the retailer or the manager that's actually implemented these changes and, interacts with the customer on a daily basis. And so I think that's a nice example of kind of hearing from the end user. The third toolkit that I'm going to talk you through is one that was developed in the US by the Center for Disease Control, the CDC, And it focuses on grocery stores, small stores, and farmers markets. And this is quite a comprehensive toolkit in general, but I'm just going to focus on one aspect of it, which is the evaluation guidance. So it does a really nice job of looking at how to assess the food environment, how to ask the right evaluation questions, how to identify what indicators and data sources you want. And it also does quite a good job of taking a step back and looking at the broader distribution systems that might impact a retailer's ability to procure healthy food and then provide it for their customers. So this toolkit has a list of evaluation frameworks that can be used to guide an evaluation of an intervention. And what I like about this resource is that it doesn't just provide kind of one example, it provides a number of different options to use that are focused on different contexts. So it gives the CDC's framework for program evaluation, which is kind of quite a broad evaluation framework, but it also has other examples like a health equity one. So that's focused on, examining evaluation in those kind of contexts. And then it has other examples such as a framework evaluation based on farmers markets. So you can kind of really pick and choose which one suits your specific context or setting. The other nice thing about this resource is that it gives really clear, precise examples of evaluation case studies. And I haven't seen this done very often, so that's why I've picked it out here. So the resource here doesn't just go into detail about what was done, but it also talks about what outcomes were measured, what methods of assessment were used to measure those outcomes and the actual impact. And it goes through quite a few examples of these. And so I think that's a nice, gives kind of nice guidance on how this could be applied in similar settings. And in this guideline, in this toolkit, there's also an appendix that has a list of questions that can be asked to evaluate the outcome of an intervention or program. And it not only does demonstrates the different evaluation questions, but it also talks about what potential indicators and data sources can be used to answer those questions. So from a researcher perspective, I think this is really great. And I think that it's a really kind of clear kind of steps through quite clearly how you could achieve a comprehensive evaluation, especially for someone that hasn't got a background in evaluation. It could be quite useful. So in reflecting what currently exists, there are lots of toolkits and guidelines to draw from internationally, and they tend to cover a range of different retail settings and contexts. Many have been designed for country-specific contexts. For example, the US talk a lot about WIC and SNAP programs, which are US-specific. However, there's only a small number of really comprehensive resources, some of which I've talked you through today. And we're also going to share an extended list of other comprehensive resources following this presentation in the coming week. So what seems to be missing, while there was some mentions of environmental sustainability, there wasn't kind of true integration of those kind of considerations. There weren't many that gave evaluation guidance, with the CDC one that I just went through being an exception rather than the rule. There weren't many that looked at co-design and explicitly engaging the retailer in the process of developing and implementing the intervention or policy. And we know from emerging academic evidence that engaging the retailer in different aspects of the policy design and intervention can be a really powerful way to kind of get them on board and keep them on board. While there were quite a few mentions of inequalities in diet, there weren't many resources that considered the impact of an intervention on health equity and on inequalities in diet. And so I think this is something that would be important to consider. Again, not many thought about the role of the broader food supply chain. And really none that I came across evaluated their own tools and thought about, what's the kind of feasibility of using these tools, and what are the benefits of using these tools. So I'm going to hand over to Vanessa now, who is going to manage the question and answer section. Thanks.
Thanks, Tara. Thanks for that excellent presentation. So we'd like to open the webinar for questions now. So there's 2 ways you can do that. Tara, you might like to stop sharing your screen so that we can see you better when you answer the questions. That's great. So participants can either pop your questions in the chat box now, and we've already had a couple come through while you've been presenting, which is great. Or you can raise your hand virtually using the Zoom controls, and we can invite you to unmute and ask your question directly if you'd like. We may not have time to answer all the questions now, depends how many we get. So we will commit that any that we don't have time for today we'll follow up on afterwards, and we'll share those with the recording and the slides as well. So I'll go first to the chat box, Tara, and the couple of questions that we've had through, and anyone else can jot theirs in the chat now. So we've got a question here from Leah, who says that you mentioned that environmental sustainability was not very evident. What criteria did you assess this, and what did you see as being environmentally sustainable? So what did that capture for you?
Great, thanks, Leah. So it's probably worth mentioning that environmental sustainability is not my area of expertise, but I kind of wanted to get a bit of a feel for how they were thinking about these kind of things. So how I measured it was looking at issues such as local food procurement, reduced meat consumption, and anything that kind of explicitly mentioned that these recommendations were designed to be in line with existing kind of planetary health recommendations. And so the ones that did seem to think about this, it was really mainly to do with sourcing local food and using kind of vegetables that were in season to reduce travel miles.
Yeah, sure. Any that jump out to you off the top of your head that you can remember that were particularly good at including the environmental sustainability side of things, or is that one you're going to have?
Not off the top of my head, but I'm going to go back and have a look at so that I can identify ones to send out that seem to do a good job of that.
Thanks, Tara. Leah says, thank you, Tara. We've got one here from Chris. Do any of the toolkits look at the value that customers and retailers get out of the different healthy versus unhealthy offerings? He goes on to say, consumer value specifically includes the time, effort, stress, and money required to acquire, prepare, and consume the food. Retail value would include risk. Healthy foods, in brackets, often have shorter shelf lives, and effort, and then in brackets, healthy foods sometimes require more tending and specific handling in the retail setting.
Yeah, that's a great question. Thanks, Chris. So it's probably worth mentioning that we didn't have an explicit focus on customers in this project, but there definitely were ones that identified or recommended evaluating customer responses to retail changes. And there were also some that recommended strategies such as doing customer taste tests, and that kind of had the dual purpose of getting the retailer kind of on board and having them have direct contact with customers who were enjoying these taste tests of healthy food options. But I think it's a really important area to consider, and it's probably lacking a little bit in the current resources. Thanks, Chris.
Thanks, Tara. Thanks, Chris. I'm just checking. Chris says thanks. Anyone else have any other questions for Tara before we move on to the interactive session? If you want to take a moment, you can pop them in the chat box now. And I'm just looking, I can't see anyone waving their hands at me.
Is there one in the chat box? Yeah.
One's just popped. Oh, we've got a couple now. Great, thanks guys. So Michelle asks, of the toolkits that were found, was there any investigation into effectiveness of them to improve engagement in healthy eating policies and practices?
Thanks, Michelle. I think that's a really great question. And so I'm assuming that your question is based on, does the toolkit assess whether the toolkit is useful in engaging retailers, if that's your, yep, okay, great. None that I could see, and I think that this was a real gap and something I think that would be really useful to address is thinking about how do we kind of integrate evidence more into the development of these toolkits. So I think it's a really important thing to think about. Thanks, Michelle.
Thanks, Michelle. And Margaret also asks, did you have any conversations with the authors of the toolkits or resources to identify which resources were most useful?
No, unfortunately not. It wasn't within the scope of this project, but that's something that I think is would be quite relevant. And I think there might be a project happening at the George Institute that is doing something quite similar, that's talking to people who are using the resources to reflect on their use. But I think that's a good idea for future future research. Thanks, Margaret.
Thanks, Margaret. Thanks, Tara. We've got time for a couple more questions if there are any more.
Everyone just wants to get to the interactive session.
I know, I think everyone's being shy. I'm just checking because I don't want to miss anyone waving their hands at me, but I don't think there are. That's great. Okay, well, we'll use this extra time then for our interactive session now. So Tara, would you mind sharing up the instructions for the session? Also, the instructions that Tara is just going to share now are also available for you to download and refer to on the chat box. So if you're on your computer, you can navigate to the chat box now, and you'll have to scroll up to get past the questions that people have asked, but there's a PDF file that you can download, and the interactive session instructions are on there. And they look complicated, but they're really not, I'll go through them now. So one of the purposes of the Nourish Network is to really foster connections between our members. So we wanted to make sure that our webinar wasn't just being spoken at, and wanted to give you the opportunity to reflect and share your thoughts with others, and hopefully other people that you might not have met before. So just to confirm that although we've recorded the main webinar, we're not going to record or share this interactive session, so do feel free to be honest and open. You are all mostly muted at the moment and are not sharing your videos, and it should automatically unmute you when you enter a room, but if it doesn't, then unmute yourself and share your video if you want to. Take a few minutes to introduce yourselves, and also choose someone to jot down a few notes while you're discussing so we don't lose those key points. I've got the questions here on the right hand side of the slide, but I'll also share with you some question prompts to keep you going so that you don't have to keep referring to the instructions. You'll get a 60-second warning before the meeting room closes, so don't worry that you'll all of a sudden be turfed out of the room mid-chat to someone. We have done 2 breakout rooms, so you'll have the first one, and then you'll get the 60-second warning that will close. You'll all come back to the main session, and then I'll redo the meeting rooms, and you'll hopefully get put with new people and go and have a second session with different questions. And then after that, you'll return to the main session again, and note takers will be able to share any key points within the chat box. And then we'll also do a wrap up and confirm next steps. Hello everyone. You can keep your videos on if you like, I can see you now. Great, I think I think that's everyone back now. Thanks very much for that. Can you just feed back in the chat whether that was long enough or did you still want more time to talk? Okay, thanks Margaret. Long enough, good. Thanks. Okay, so thanks very much everyone for that. So I hope that was really useful and you made some new connections and met new faces. Note takers from those 2 sessions, I feel like this is a bit like Goldilocks, those sessions. We've got some people saying that it's okay, some saying too short and some saying too long. So, but thanks for that feedback. We will send a survey round, a very short survey after the webinar when we send the slides round to get some feedback so that we can try and smooth out the interactive session component of the webinar. Can note takers just share any key points in the chat box now to everyone? I'm just gonna make sure I'm recording. Yep. We'll also leave the meeting room open for 5 minutes to allow you to do that. So don't worry about hurrying to write those down now. We'll leave it open and you can jot them down afterwards. And if you were not a note taker but had some thoughts that you wanted to add, any reflections, please go ahead and pop those in as well. And of course, as a participant, you'll all be able to see that feedback that goes into the chat box, which is also a great way, save us all hearing from everyone individually. You can just have a read through what was coming out of all the other meeting rooms. We had 6 meeting rooms going on, so there were quite a few groups talking at the same time, so hopefully there'll be a diversity in the feedback. So we're going to share the slides, presentation, a summary of the interactive session in terms of what came out, the key reflections, and also a list of top resources from Tara's review. And we'll do that on the Nourish Network website, which isn't up yet, but we'll email the link to that in the next week or so. And as I mentioned, we'll also circulate a short survey to gather feedback on the webinar to help us plan for future sessions. So thank you again for contributing. Tara, if you're still there, I might ask you to hop on and share any reflections from your meeting rooms. You might need to unshare your slides so we can see you.
I think I'm unmuted. Yeah, so it was really great to hear everyone's kind of perspectives, and I think there's probably too much for me to go into, and I'm having a quick look at the chat box and there's really fantastic feedback, so thanks everyone for that. Some of the feedback I got was that it would be useful to, from the HEAS perspective, to look at some of the resources and toolkits in more detail, and to really think about what's worked well and how that could be implemented here. And that it is quite important to be able to demonstrate the value to the retailer because they have a different set of priorities, and so guidance on that is always appreciated. And I also we got some nice feedback that the webinars have been, during this COVID period, the webinars have been quite useful in terms of accessing experts and connecting with other people, and so that we should continue them. So that's quite nice as well. And I'll just leave it off there, and we'll send around a summary of all the feedback, as Vanessa mentioned. Thanks.
Great, thanks Tara. So thanks everyone again. Please do pop in the chat box any thoughts or reflections that you've had. We'll leave this open till 1 p.m. And look forward to seeing you again next time. Thank you.
Thanks everyone.